we have a guest that's not on the panel. I'd like her to introduce yourself.
Sharon Dutkowski.
And with?
I'm with the Salvation Army Kroc Center. I work alongside with Patti.
And you're going to be helping her with the presentation here, okay? This is also Patti Phillips, who is with the Salvation Army Kroc Center. And to her left, we also have Sharon Rogers, and he is with the Department of Management, College of Business at New Mexico State University. So I'm going to let you guys go ahead and get rolling here, okay? And we'll start off with Patti.
It is a really special privilege to be here today. I've had the privilege of studying under several people who are here, and I'm excited to get to know people that I don't already know or have acquaintance with. So we're looking forward to talking to you about, from a practitioner's perspective, what is going on in the realm of impact, social impact in the social field at the Salvation Army Kroc Center here in town. This is my colleague, Sharon Dutkowski. She is the Membership Services Director at the Kroc Center, and I asked her to come along with me today because she is the guru of everything, and by everything I mean everything that happens under the roof of the Kroc Center. She manages a vast majority of our staff. She does all of the member services. She deals with all of the member issues, all of the member happiness and unhappiness, and she also runs all of the programs at the Kroc Center. So she's going to be here to kind of add in some of the real stories of what happens at the Kroc Center. What I'd like to do is have a conversation. It's kind of a Venn diagram conversation at the intersection of four special people who have a particular impact with the Kroc Center, its development, and its ideology and theories. Peter Benson is the founder of the Search Institute, which the Salvation Army has a national relationship with. He is the one who developed the 40 developmental assets and Sparks, which we're going to talk a little bit about today. Also, obviously, Joan Kroc, and of course, I had to throw in her photo there with Father Ted because they were very close friends. She is obviously the person who gave the money, the great philanthropist who made the Kroc Centers possible. And then that's Otto Scharmer and William Booth, who is the founder of the Salvation Army. Looking at this in terms of Sparks and the 40 developmental assets as being, okay, when you have a measurement, the concept of measurement, you have matter plus container plus, what does that say? Mechanism, thank you. Matter plus container plus mechanism, and then you get measurement. And so in terms of matter, matter's not a thing, but a relationship, but a web of relationships, actors that act upon each other. And then the container is the context in which those relationship dynamics play out. And then the mechanism is what causes the shift or altering in the social field. And it really speaks to the source of attention from which we act. And Otto Scharmer specifically is about leading from a future that wants to emerge. So social impact in the social field, when we started to develop the Kroc Centers, I think anytime you start to enroll and register people in a new concept or a new idea, you are automatically talking about the possibility of transformation, the possibility of a better future. And so that's what we've talked about all along, is how can we better connect to and learn from the possibility of an emerging future or a future possibility. And the way that we try to do that is by deepening the connection between the visible and the invisible. So for us, the social impact itself is the visible component, and the invisible component is the social field, or the source from which people interact with each other, how they talk to each other, how they look at each other, how they behave towards one another. And the quality of the visible is a direct result of the quality and integrity of the invisible. So for us, deepening the connection between those two things is a way to create transformation in our community. So this is the Kroc Center. We're going to start by talking about the container here. It is a vast 110,000 square foot bit of loveliness. It is, we have spaces here for fitness, for sports and athletics, for hanging out, for climbing walls, for swimming, for education, for arts, for recording studios, for any number of stages and ways for people to come together to, as we're talking about here, act upon one another, to interact with each other. And so the Kroc Center becomes the context in which this web of relationships and interactions and the patterns of that unfold. Sometimes we refer to this as redefining community. And a lot of times we think of community as a group of people or a place that is like me, where I belong. And what we wanted to do was expand the concept of community. So we wanted to use that common sensibility about what community is, that it's a place where I belong, it's a place where you belong. But also change that up a little bit in that it is full of diversity. It is brimming with diversity. People from different socioeconomic levels, different racial backgrounds, different all kinds of everything. But it is a place where people who may not normally come together and become friends actually do come together and become friends. We redefine community in several ways. So by embracing and enhancing the bigger sense of community, by translating community, by deepening those connections, and by also creating communities by developing and evolving our listening of one another. So Sharon's going to actually tell us some stories about how this is actually happening.
I thought it was interesting when Roxanne was talking earlier about embracing the community, and I instantly thought about You Belong Here and what we're doing with the concept at the Kroc Center. You know, I walk through the Kroc Center, and as Patti said, I'm kind of walking around the building almost all day. And when I walk into the fitness center and I see somebody on a scholarship who has lost their job and is really down and out, walking on the treadmill next to the CEO of a company at lunchtime, neither one of them know each other's story, but they're engaging in this great conversation, usually about Notre Dame football or something like that. But it's really interesting to see kind of that diversity happening right before you. But when we intentionally set things up, like with the Crossings group, I'm not sure if any of you are aware of the Crossings group. It's a school in this area that is, how would you?
It's an alternative school for kids who basically have been completely expelled from the public school corporation, so they're not allowed to go back to public school.
Right. So we have the school setting at the Kroc Center, and the kids come in and they go to school, and then they're a part of the Kroc Center. And the design of that is that they probably never would want to come to the Kroc Center, or they wouldn't feel comfortable coming to the Kroc Center. But because they come to school there, they have this great pride that now they're a part of the Kroc Center, to the point where a young man was at the bank a week or so ago, and he was trying to set up his account, and on his key ring he had this I Belong tag, his tag for the Kroc Center. And the teller said, "Oh, you go to the Kroc Center." And there was this great interaction that happened outside of the Kroc Center because of him going to school, and that door was open for him to have the ability to be a part of something. The special needs families that we have, we've now developed a great relationship with a lot of the special needs groups in the community. Several of those groups have struggled with being able to utilize centers in the area. And what we found is that the connections with folks at the Kroc Center have really grown to more relational and community building. And did you want to say anything else about that? No? Okay. Lastly, Patti talked a little bit about creating a community. About 5 months ago, a young man who's my age actually, I'm going to say that's young, came to my office and said he's been thinking about cycling across the country. And he's really would like to do it for a nonprofit group out of Indianapolis that assists young pregnant women. And he really didn't know what to do, that this was on his heart, but didn't really know what to do to get from point A to Z. And we started talking about it, and he and I take cycle class together, so we started talking about it in cycle class, and the class really supported him in his conversation. We talked about the fact that there's across the country there's Kroc Centers, And so he went back and developed a map to travel across the country, hitting Kroc Centers along his way, to raise funds for this nonprofit group in Indianapolis. And what I loved about that is that the Salvation Army embraced that as part of supporting him. Even though he wasn't raising funds for the Salvation Army, he was causing awareness through the country at all of these Kroc Centers. So he started in May, and he finished last Friday, traveling across the country by bike. And at each Kroc Center, they embraced him and helped him. They either rode with him or found housing for him or whatnot. And he raised awareness in multiple ways, and really helped the Kroc Center community understand that with a little bit of effort, well, probably cycling across the country isn't a little bit of effort, but through a little bit of his pushing and asking questions, he got great support to do that and really impacted several people along the way.
And what I love about that is that it is a community within a community, that the cycle class really rallied around him, supported him. They got media coverage around him, and that he took a strength that he had developed through his participation in the Kroc Center and made good of that for the people in his world, and the people who he knew he could have an impact on. And so it is it's kind of, the Fabergé style of good multiplying itself. And that's part of the impact that a place like this holds, again, at the intersection of these different ideas. Something we know is that there are 80 million teenagers or youth, middle school through high school, children in this country, and only a quarter of them are on the path to human thriving. For the other 3/4, they have fallen off of that path. And for them, it's no longer about purpose and hope and connectedness and joy. It's become more about being alone, feeling empty, being medicated, or generally just being lost. And at the Kroc Center, what we, in embracing Peter Benson's idea of the 40 developmental assets and of Sparks, we take the perspective that youth are not vessels to be filled, but fires to be lit. And what we know about human development is that the best kind of development comes from the inside out rather than the outside in. So although you can fill an empty vessel, and to some extent that's good with rules and expectations and boundaries and guidelines, the real question of human development is letting this fire emerge in life. So the core idea in human thriving is the identification of that human fire, that human spark, that fire within. So spark is very akin to the idea of spirit, which is my breath put into the world with vigor, courage, and purpose. My breath, it's the ultimate question that we can ask of each other. What is your breath? What is your spark? When the Search Institute studied this issue in general, they interviewed 6,500 middle school students, and they asked them this question about sparks. Did they know their spark? But they asked it in a three-dimensional kind of way, which is very interesting because it lends itself to the dimensionality of the question. And that is, number one, do you know your spark? Number two, does anybody else know your spark? And number three, does anybody care or nurture that spark in you? And so I think the question we can often think about is, what is your spark I'm dying to know? It is that animating engine, that thing that lights us up. So there are lots of things to say about sparks, and obviously we have a limited amount of time, so I'm going to illustrate something for you. This is Leah Adler. Does anybody know who she is? If you do, don't say anything. She is a parent. When her son was 7 years old, he cut off the head of a doll, put it on a plate of lettuce, set it on a platter, took it to his mother, and said, "Mom, look, isn't this cool?" And then when he was 12, he boiled a pot of water, put 6 cans of unopened cherries in the pot of boiling water, waited for them to explode, and then filmed the cherries and the juice running down the walls of the kitchen. So if you were his parent, you might be upset with the mess. You might wonder, what are you doing? That's dangerous, don't do that. You might, even be looking for professional help or maybe even reform school. But Leah Adler did not do that. She is actually the mother of Steven Spielberg, and I think she cut him some slack. So what sparks allow you to do is to respond to your child or any child that you might be working with when they are saying, see me, see and notice what I bring to the human party. So Search came up with this thriving formula, which basically is, you know your sparks, you have 3 champions that help you, that believe in you, that believe in your spark in you, and then you have opportunities to develop and express that spark. I think that is a unique place that the Kroc Center sits as well, because we can offer all of those opportunities to express those sparks, as well as helping people identify it and championing these children as they walk through this process. The cool thing is that when this formula is in place, things really start to happen. So school success skyrockets, engagement in school goes up, compassion for others increases, violence decreases, and kids feel an increased sense of purpose towards their lives. So here, when this formula is present, you have matter, this web of relationships, focused on thriving. The last piece of this is the mechanism, and I will say that this is probably the most natural and the most difficult component of this measurement piece for us as practitioners. We talk about walking the walk and talking the talk, and we have to learn to walk and talk, right? So, we're sort of finding our way and doing both. This part is, the mechanism piece is natural for us, because if we look at the interior condition of where the action takes place. So we look at social impact, we look at what it takes to change the social field, and what really makes the difference is the interior condition of the intervener. And I think that's why I was really interested in what Roxanne was saying in leadership and why leadership is so important. But what's even more important in the concept of leadership is the interior condition of the leader themselves. And that's a part of the mechanism, and it's part of how we have to listen for one another. It's part of how we have to train and develop ourselves and our staff and our talent and personalities that we work with. This is a quote from Otto Scharmer, and I just really love it. What he says is, the real battle in the world today is not among civilizations or cultures, but among the different evolutionary futures that are possible for us. What is at stake is a choice of who we are, who we want to be, and where we want to take the world we live in. We need to go beyond the concept of leadership. We must discover a more profound integration of the heart, the head, and the hands. And so as practitioners, what I would say to you is that we need collaborative research action partners. We need to be able to find a more subtle set of data and experiences from within, and really think differently about that future that is leading from that future that wants to emerge, and leading from that future possibility. Paying very careful attention and deep attention to, again, how we listen to one another, how we talk to one another, and how we act towards one another. Thank you.
All right, so good morning. Good morning, sorry. We're still morning, right? Okay. My name is Sharon Rogers. I'm from New Mexico State University. My co-authors on this paper is Kaifeng Jiang, my PhD classmate at Rutgers, who's joining the faculty here at Mendoza as we speak, and then Carmen Rogers, yes, there is a relation, my wife, who's in the business school at UTEP, University of Texas, El Paso. I'm going to try to build on all of the comments and remarks that have been made thus far. We've heard a lot of really good things. I'll give you a little bit about my background. So my actual work experience is not in nonprofits. My work experience is in private industry, mainly in the transportation and airline industries, in industrial engineering, in corporate finance, strategy, planning, yield and revenue management, about a decade's worth of that before I went to PhD school. So when Roxanne mentioned the guy from EDS saying, so what? And I worked with a lot of folks from EDS, especially when I was doing finance, that resonated with me. And so as I study, and my background is HR, my background is human resource management and employment relations. but I do I have a lot of involvement in the community myself, and so as part of my academic research, I became very interested in volunteers. And volunteers we largely find in the nonprofit sector. And so I bring a lot of that analytical and that questioning, that so what, to the study and the management of volunteers. How many folks have worked in organizations that have managed or have dealt with volunteers? How many folks have worked in organizations where you could clearly link the performance of your volunteers to the organizational outcomes? Okay, so fewer numbers. That's what we're going to talk about today. We're going to talk about the link between volunteer management and individual and organizational performance. This is an exploratory study. Really, I'm building on the work of mainstream human resource management, and specifically strategic HR, a thread that we call strategic HR, and I'm applying this for the first time to the management of volunteers. And the reason this is exploratory and we want to actually dive deeper into this is because we know that the volunteer workforce has different characteristics than paid employment, paid workers, right? Motivations are different. Some of the characteristics of the workers and the workforce is different. So we want to take care to not just overlay what we know about paid workers and how you manage them and how you drive performance via them to volunteers. And so this is exploratory. A lot of it mirrors the research that has been done on paid workers. Two main questions that we explore in this paper. One, why do different nonprofits manage volunteers differently? So that's the lesser of the two questions that we want to ask, but we wanted to just see, where do these volunteer management practices come from? Are they at all tied to the larger organizational strategy or how the nonprofit orients or positions itself to accomplish its mission? The larger question here, the one that we're most interested in, is can volunteer resource management, VRM, affect a nonprofit's performance? That is, can volunteers be managed in a way that actually drives performance up and adds value to firms? That's what we're going to try to answer today. The existing VRM research that's out there are three characteristics of it. One, it looks at the extent of adoption of VRM practices. Which nonprofits use what practices? It also looks at nonprofit demographics, that is things like nonprofit size, their age, the type of services they provide, and tries to associate that with VRM practice adoption. In terms of the efficacy of volunteer resource management, existing research looks at the efficacy of individual practices, right? What effect does one practice have on the volunteer workforce and the organization? Here's what we feel this research in this paper adds above and beyond to what exists. It explores the role of organizational strategy in volunteer resource management. So not looking at VRM in isolation, but looking at it as it is linked to the larger organizational strategy. We want to take a systems perspective. So rather than looking at practices in isolation, we want to look at how an entire system of volunteer HR practices works together to drive or not to drive organizational outcomes, right? And then finally, we're considering what we're talking about today, performance measures, right? Linking VRM to performance measures. Right now, everything that's out there in the literature, well, there's really nothing in the literature, but the discussions that are being made are largely anecdotal. Yes, volunteers add value. Yes, they're important to our organization. But when you ask that, so what, right, that a hospital CEO would ask before they invest money into the volunteer administration function, you can't really answer that, right? You don't really have any hard data to give to this person. So this is what we try to do with this exploratory research. And here's a theoretical model. we're trying to link hospital strategy to VRM practices and a system which we call a high commitment work practices system. And I'll talk a little bit more about what that means. That terminology comes out of the strategic HR literature, and how that VRM system then affects individual volunteer performance or outcomes, and ultimately organizational outcomes. In this case, we're looking at patient satisfaction in hospitals. Can volunteer management actually influence patient satisfaction in a hospital, and can you draw that link? We also controlled for a few things here. Hospital size, volunteer hours, and volunteer to staff ratio. Some things that have been found to affect the volunteer function in previous literature. So let me provide some background. Strategy is a driver for HRM. Like I said, I'm coming out of the strategic HR literature, which looks at how HRM reflects a firm's strategic position. This is the left-hand side of that model. Famous work that's been done in this area by Arthur up at Purdue in 1992 and 1994. He did a classic study, actually a couple of studies, where he looked at firms, and these were manufacturing firms. He looked at their organizational strategy, whether they were a cost leader, that is, they tried to minimize costs, or whether they were a differentiator or a quality maximizer. So they focused on quality and not so much reducing costs. Cost leaders tended to employ a control-based or a cost reduction HRM strategy. That is, they tried to minimize the cost of human resources, right? And they did so by having low entry skill requirement. They limited employee training and development. There was a lot of supervision and control because we wanted to manage product output via, control of the worker. And there was little communication going to the worker, little socialization efforts. And then on the flip side, differentiators or quality maximization firms had an opposite approach, what he termed a high commitment HRM approach. Well, why does this matter? He found that commitment HR systems resulted in lower employee turnover and higher productivity and efficiency at the individual and the plant level, right? So he found positive returns when you invested in and committed to your workers, and this included investing resources into them. This spawned decades, a couple of decades now, of studies in the strain we call high performance work systems, high commitment work systems, high involvement work systems, high road strategies, so forth and so on. And so what we're trying to do in this paper is overlay this high commitment work strategy stream onto the management of volunteers and see, does it hold? Does it make sense to manage volunteers? Can you actually drive organizational performance through volunteers, or should you direct resources elsewhere? So what might a VRM system look like? We comb the nonprofit and the volunteer management literature to find practices. How do nonprofits, how do managers manage volunteers? And we found 23 that seem to be a mainstay in the literature. And so we categorize these into six categories of position and development, job design, recruitment and staffing, so forth and so on. And so what we did was we created the VRM system, and here's an example of what a VRM system might look like, or the components thereof, as it relates to position development and design. So we asked about whether there was a written statement of philosophy regarding volunteer involvement in the nonprofit, whether you had written policies for how paid staff were to interact with volunteers, so forth and so on. So we have this entire system, and we ask directors of volunteers, to what extent do you do these things within your organization? We asked them for all 23 on a 5-point scale. So we're getting some variation there in terms of how high the commitment and investment is in the volunteer in the volunteer workforce and the management of it, or how low it is. The second part of that model, which we're most interested in here, this is the thing that we can kind of wrap our heads around as managers, does VRM affect performance, right? Are there returns to investments in volunteers, and specifically volunteer management. And so we look at the effect of these high commitment VRM systems on the volunteers themselves, and then the ultimate effect on hospital patient satisfaction. We get some clues from the strategic HR literature. This model actually works. If you look at the research that's been done in private firms applied to paid workers, right? And it has, just as was displayed on the model, that kind of proximal effect on the workers and then an ultimate effect on the organization. The latest paper on this was actually by the second author published in the Academy of Management Journal, which talks about how high performance work systems work. So let me tell you a little bit about the study, and then I'm going to bring it home here because I know we're running low on time. We focused on the hospital and healthcare industry because we wanted to find organizations or a sector where there was a strong and established volunteer workforce, right? And certainly hospitals, for at least the past 100 years, have been utilizing volunteers in their workforce. We have data from 107 hospitals in the Northeast and the South that translated to a 22% response rate. We sent to almost 500 hospitals. About half the hospitals were rural, half were in metropolitan or urban areas. On average, these hospitals had 261 patient beds. On average, they employed 341, or they utilized 341 volunteers over a 12-month period. And on average, these hospitals employed 1,800, almost 1,900 paid employees. The measures, and I won't go too much into detail with this or the results. If you're interested in the data, you can certainly get that from me, or the measurement properties or the psychometrics. But we did use established measurements all around. These are collected from the hospitals themselves, except for this last one, which is actually Health and Human Services data, secondary data, the HCAHPS data. HCAHPS is hospital data that's collected by the federal government, used to benchmark hospital performance and so forth and so on. There are two questions that they ask about patient satisfaction. And here are the results. And again, I won't go into great detail into this, into the actual statistics here, except to say that the black numbers, the positive with the stars next to them, mean that there is a statistical relationship there. So we're seeing a statistical relationship between hospital strategy, whether the hospital has a cost reduction orientation or a quality maximization orientation, and the adoption of, and utilization actually, of a volunteer high commitment work system. And we're seeing that being positively related to volunteer human capital, which is the amount of skills that a volunteer has and brings to the table, volunteer motivation to actually work, and then volunteer autonomy. Volunteer autonomy describes the volunteer's perception of the control that they have over their work and that they can actually make a difference through their work. Two of these actually impact patient satisfaction ratings or organizational outcomes. The human capital, the skills, volunteers having higher skills, and that makes sense. So if you have a targeted recruitment and selection effort, and then you train and develop them when they get in, right, they're going to have higher skills. They're going to know how to do their jobs better, right? They're going to know how to contribute, and then that's going to drive organizational outcomes. Also, volunteer autonomy. They feel empowered to actually do this work. Now that they have the skills, there's not intense supervision over them. They feel as though they have the power to make a difference. Interestingly, volunteer motivation, we didn't find any relationship between that and patient satisfaction. So we're exploring that. We don't exactly know why that is. We know that volunteer motivation is a little bit different than worker motivation, so we're digging into some of the literature now that describes what motivates a volunteer to work and to continue to work. And maybe that'll help to explain why that has no relation, although that could be just a nuance of our study, very much so. So some of the takeaways, we did see a link between firm strategy and the way that volunteers are managed. Again, as I just mentioned, volunteer motivation didn't have that ultimate impact. Here's the biggest thing, right? At least from our data, which is just one study, out of many that need to be done in the future. Seems like nonprofits can proactively, typo there, my bad, manage their volunteers in a way that actually enhances bottom line outcomes, right? And using this data, so I talked to a lot of directors of volunteers at hospitals, and one major complaint is that the volunteer function is not looked upon as important by the hospital executives, right? By the CEO, by the folks in the C-suite. And as such, the volunteer administration function doesn't get the resources that it needs, right? Well, here we're drawing a link. Here, we're taking a stab at providing them that initial data that shows, look, the way that you manage your volunteer workforce does actually matter for bottom line outcomes, right? So it makes sense to invest in, right, and not overload your volunteer managers. Usually in a hospital, the volunteer manager is the gift shop manager, and they manage they do like 3 or 4 different jobs, right? A lot of that is probably because of this, ideology, the volunteer function. Okay, we just need somebody to manage that. That's not very important. Well, it is important, right? It drives patient satisfaction, which in the hospital realm, in this movement toward pay for performance, HCAHPS rating and all of that, now that starts to really make a difference. And hopefully, this can translate, and we can do more of this sort of research and other types of nonprofit organizations to try to establish that link, right? Whether it's Big Brothers, Big Sisters, Boys and Girls Club, Salvation Army, whatever the metrics are, does the way that we manage volunteers matter? I'll end it with this, a couple of related projects if you're interested in this type of stuff. Next month, using the same data, but other data from the same data collection, we have an article coming out in the journal Hospital Topics, which talked about the challenges and opportunities in volunteer management from a healthcare administrator's perspective, right? And in that, we talk about some strategies, including performance management, right? And we talk about 2 prongs of performance management: performance measurement, which is the first step in performance management, and then the second and less used, performance information use, right? Because a lot of nonprofits, a lot of organizations, a lot of private firms collect information, but they don't actually use it, or they measure, but they don't use it in decision making, right? So we talk about that, and then later this year at the Association for Research on Nonprofit Organizations and Voluntary Action, I'll be presenting a paper, again, using data from this data collection, looking at the effect of the volunteer administration function within hospitals, or the characteristics of that function on VRM. So we're looking at things like where the nonprofit positions volunteer management in the organizational hierarchy, the scope of the responsibility that they give to volunteer managers. We're looking at the size of the paid staff, things like that, and how that affects volunteer research management. So with that, I believe I'm done. Thank you very much.
Take about 5 minutes for questions and still stay on schedule, so. Over here.
Yes?
I have a question. Have you taken a look at linking you've identified the characteristics of the volunteer staff in terms of impact on the outcomes. Have you taken a look to see if there's any link between the role of the volunteer staff on the morale and retention of the paid employees in a hospital setting?
That's a very great question. We haven't in our data. There has actually been some work done on that by Stephen Rogelberg at UNC Charlotte and his colleagues, published in Nonprofit Management and Leadership, 2010. He looked at the effect of volunteers on paid staff. I think the title might be something very similar to that. But he does dive into that, so that might be something worth looking into. And then certainly we want to expand on his work and dive into that more in our future research.
Because certainly if you're looking to influence the key decision makers in terms of strategy and getting resources, if you could
Right.
improve causal link in that, it might help.
Right.
Did you look at boards at all?
I did not. We did not. That's something we want to do in the future, though. It's very important. Yes, sir.
Hi, this is Jeff Faulkner. In the industry we work in, basically finance, the Community Reinvestment Act has a strong influence on the supply of volunteers, primarily from banks. And then that has an interrelationship with the bank's abilities to then make grants to nonprofits in that area. Have you looked at any kind of regulatory influenced relationship with volunteers and corporate strategy at this point?
I have not in this work. I've actually done a little bit of that. My dissertation looks at, it addresses a lot of questions related to volunteer management. I know some work on, although this would be different, some work out of Canada looks at regulatory concerns as it relates to volunteers, but of course that legal environment would be a little bit different. But no, that's an important question, especially now. The Department of Labor has started to look at volunteers, and they're putting tighter reins on, what constitutes a volunteer and the type of work that they can do. There's been a bulletin as part of the, I think it's the Fair Labor Standards Act or something that's come out quite recently that talks about that, but that is something that we want to look to in the future, because I think that's going to be important as it concerns the supply of volunteer labor.